A very good evening and warm welcome to all of you who have joined us today for this Twitter Space conversation on menstrual health and hygiene management for persons with disabilities. We are holding this conversation today as tomorrow is Menstrual Hygiene Day. Despite the fact that menstruation is a basic and natural physiological aspect of our sexual and reproductive health, the lack of education and discussion around this topic is actually quite frankly alarming. So, the mere mention of periods or period blood somehow invokes shame, disgust, and horror among people. The celebration of Menstrual Hygiene Day was started in 2014 to break this silence, to raise awareness, and to change the negative social norms around menstrual health and hygiene. The idea is to stay committed to create a world by 2030 where no one is held back just on account of the fact that they menstruate. I am Nitika Kakkar. I am senior program manager with a Delhi-based non-profit called Smart. I work with women from some of the most marginalized communities across the country on issues that have a direct impact on their lives, such as gender-based violence, health, and nutrition. I feel extremely fortunate to moderate this discussion and this session today, where we have a panel comprising of highly illustrious individuals who have been working towards improving the lives of women and girls across the country. I'll now take the opportunity to introduce our first panelist. She is Miss Anjali Singhania. Anjali works as project officer at WaterAid India. She is a passionate advocate of menstrual health and hygiene and uses evidence to inform policies and programs on informed product choice and menstrual waste management solutions. She employs qualitative research to explore under-researched areas in India on menstrual health hygiene for persons with disabilities and menstrual health and hygiene management in emergencies. A very warm welcome to you, Anjali. Are you here with us?
Yes, thank you so much, Nitika, for the introduction.
Thank you. Our second panelist for today is also called Anjali, but she is Dr. Anjali Agarwal. Dr. Anjali is a disability rights advocate, accessibility, mobility, and WASH specialist. She co-founded Samarthyam, a National Center for Accessible Environments in 1993. The National Center for Accessible Environments works with Women with Disabilities Forum for Action. It works to promote, ensure, and uphold rights of children and people with disabilities. She is also a member of Niti Aayog. And as a woman of disability herself, Dr. Anjali believes in active advocacy and has brought policy level changes. She undertakes accessibility, walkability, and road safety audits in built and outdoor environments, transportation infrastructure with gender and disability inclusive agenda. Extremely honored to have you here with us, Dr. Anjali. Dr. Anjali, I hope you are connected with us. I am not sure if Dr. Anjali, can you kindly check if your mic is on? Okay, I think we will. I am not able to hear you if you are trying to speak. Maybe if you could rejoin, and that would help. In the meanwhile, I'll take this opportunity to introduce our third panelist of the evening. We are joined today by Mr. Deep Bajaj, who is the co-founder and CEO of Sirona, which is an award-winning startup whose unique products are known for solving unaddressed intimate and menstrual hygiene issues faced by women. Sirona is they are most popular for India's highest selling menstrual cups, which have been used by over 1 million Indian women, and also for P-Buddy, which is India's first female urination device. Very, very happy to have you here with us today, Deep.
Thank you, ma'am. It's a pleasure to be here.
Thank you. So I will first pose my question to you, Anjali. I am waiting in the meanwhile for Dr. Anjali to either rejoin, or Dr. Anjali, if you can speak at any point of time to let us know that you are here and connected with us, that will be very helpful. Um, Kuljan, if you could also kindly please check on this. But in the meanwhile, I will first pose my question to you, Anjali. So, in reference to the flagship report of WaterAid India, can you please describe the challenges and barriers faced by women and girls with disabilities when they are trying to access information regarding menstrual health, services, and even, the right products and the wash infrastructure? If you could just kindly walk us through that.
Sure. Thank you so much, Nitika, for the question. So I believe that the needs of menstrual health and hygiene for any person, including person with disabilities, relates to the MHHM or menstrual health and hygiene management value chain. And by that, I mean awareness, addressing social norms, or accessing effective and safe menstrual hygiene products, and responsive and inclusive water sanitation and hygiene facilities. However, when we look at persons with disabilities who menstruate, accessing these support services becomes very complicated, mainly because they face triple burden of like social stigma. So one of being a female, second of having a disability, and third of experiencing menstruation. So one of the biggest challenges that we that persons with disabilities face is accessing information and awareness. So often there is a misconception regarding persons with disabilities that they are asexual, or unsuitable for marriage, or unable to manage their fertility or raise children. Hence, from all stakeholders around themselves, so like caregivers, frontline workers, they're not given this information. And where information is available to them, it's not available in disability specific accessible format. So for instance, uh, mainstream IEC materials or information education materials that are available are very text heavy. So, for example, a person with intellectual disability would be at a disadvantage because they would not be able to comprehend this, and this will be way above the level of comprehension a person with intellectual disability. And similarly, mainstream IEC materials are again text heavy. They're not available in braille format or in audio format. So persons with a person with hearing or speech impairment or visual impairment are unable to access these information and education materials available. Second, with respect to products, I'd like to quote Ash Gray. She is a disability rights activist based out of US, and she very aptly puts that there is no one period product that suits everybody or everybody. By that, I'm trying to I try to I mean that persons with different disabilities have different needs, and we've not been able to understand these different needs of people, of persons with disabilities. So take for example a person with locomotor or like physical disability, who's using a wheelchair. They sit on a wheelchair for long duration, experiencing perspiration and also experiencing menstruation, right? So when it comes to menstrual hygiene products, they products need to be adapted to their these needs. So like there is a requirement for extra coverage products that have extra coverage. They're extra long, comfortable, extra absorbent or adhesive in these cases. Or in some cases also persons with visual impairment, it's been seen that they face difficulties in placing a menstrual pad on their underwear. So we need to be able to take all of these needs into account when we are also talking about products. And now, even when we have access to a product, when we have access to information, what is very critical is that we also have access to inclusive sanitation facilities to be able to maintain hygiene. And from what we've seen is that person with disabilities, they try to restrict their food intake or liquid intake, so that they're not annoying their caregivers to go use the sanitation facility. And they sometimes even have low moral or low self esteem as well, because they're not able to do these basic hygiene hygiene routine by themselves. So they're relying on their caregivers for urination, for washing, um, for changing their menstrual hygiene products. And at the same time, lack of inclusive sanitation facilities also provides some lack of privacy and dignity. This is what we've seen, and these are some of the challenges that we've come across when we were speaking with disability people's organization, as well as organizations that work on menstrual health and hygiene.
Thank you so much for sharing those insights with us, Anjali. And you very rightly said that when we talk about these things, when we talk about the rights of providing people with disability the right to dignity to menstruate, it is very important for us to take into account the conversation of their caregivers, because there is a lot that is also riding on them and the support that they provide. Dr. Anjali, are you here with us?
Yes, I'm very much here.
Thank you so much for joining. And I would like to pose my next question to you, and carrying on from what Anjali was just saying, that as we know, women and girls with disabilities, they face the triple burden actually of stigma, discrimination attached to menstruation, to being disabled, and then just to, on account of being women. So, how can we address this particular burden?
Okay, first thing, I will not call it a burden because it's a natural fact of life, and every woman has to go through it at some point of time. So what happens is it's basically the stigma, the taboo, and also the practicalities of the menstruation hygiene and information which lacks in most of the families, and especially if the girl is with disability or with severe and multiple disabilities. So, I think the most important entry points are for meeting the needs of menstruators with disabilities is to be informed, both the caregivers and the girl and women with disability. They should be empowered to see how to use these particular 5 days or 6 days, how to look after themselves, how to take care of themselves, how to maintain hygiene, and also to live with that quality life with respect and the dignity. And the most important thing is agency. I'm using the word agency here because when I was doing my shadow report on violence against women, one of the facts that came up was from many of the families and caregivers of women with severe and multiple disabilities that they wanted their girls to be sterilized. Now, that is one thing which actually raised a lot of questions. Who gave them the agency to take such decisions without getting the consent of the women with disabilities? And then we were told that since they cannot take their own decision, that is why this particular aspect was chosen, so that they don't get pregnant um, unknowingly and for many reasons, because of rape and violence and many other things. But something that did not actually occur to these families and to communities is that being raped and being pregnant is one part of it, but if you are taking away the right to menstruate, is actually to take away the right to be women. So I think what we need to do is to look at the common factors, and the common factors of raising awareness through accessible information formats, or maybe by talking about it and providing assistance and providing privacy while changing, support from both male and female members in the family, and zero tolerance towards sterilization of women with severe and multiple disability are some of the most important policy decisions that we must take. And another thing which I am really actually concerned about many of the times when we speak to girls and women with disability, that girls are not mentally prepared, or they are unaware of the fact that the first cycle, what is the kind of the perception, the understanding, and how they should react to their bodily requirement, or how would family would give them the message. So very recently we started talking about the girls and women, especially the girls who are homebound because of the factor that they are not being educated in mainstream schools and they are not able to go to the schools, and these are multiple disability or severe disability girls. So I think the first factor is the parents, the nodal teachers or the special educators who comes to their families, and to get a guidebook on, which is a picture guidebook, to make them understand that it happens to every woman. Your mother, your sister, your mommy, your nani, your dadi, everybody will go through that phase. So it's okay to be happening with you, one. And two, don't panic. Three, availability of the menstruation materials, which is very very important, whether it is a cloth, how to manage it, when to wash it, when to dry it, how to make use of it, if you reuse it, and what are the disposable materials that can be used. These are all the factors what I think is very very important.
Thank you so much, Dr. Anjali, for highlighting those aspects and especially highlighting the part where you talked about agency and where you talked about how menstrual suppression is a very real thing which happens, wherein there's forced sterilization, especially with women and girls with disabilities, because the caregivers feel that it is they will not be able to deal or provide the right care to them, or even the fact that it is a that they don't want them to get pregnant. And taking the conversation forward from what you just said, and the dignity that needs to be given, and is a right actually of all women and all girls. I would like to know from you that at an individual level and at a community level, how can we ensure that women and girls with disabilities get this, are able to realize this right to menstruate safely, can get the dignity and respect that is rightly owed to them without violating their bodily autonomy and consent?
Yeah, Nikita, this is a very important question that you have asked me, and I think we must all together come forward and pay attention to defining, monitoring, and investing in menstruation health. And this should happen from policy to implementation, articulating both from top down and bottom up approach. Uh, I have seen when we have started talking about period talks, or when we are talking about menstruation hygiene management in communities, especially if it is a village or a block level or a district level community meetings, then most of the women start, having a shy or shoo shoo effect, that not to talk about it, and talk not to talk about among men around them, but to talk when we are alone. So I think most of the times we have to give this message that you are the women with disabilities who have to become the ambassadors and champions to stand up for, not for the cause, quote unquote, this is not the cause, and as you rightly said, it's the rights of all women with disabilities, and we must create a mass impact through social medias, through talking it into the panchayat level, talking to the schools, in communities, in families, in neighborhoods, so that it doesn't become a stigma or a talk that we cannot talk about, like we have been talking about many other things. For example, we talk about good touch and bad touch in a big way now. We do talk about protection against sexual abuse and violence, but why aren't we talking about menstruation hygiene, which is something which is missing for a long time? And second, even with the Swachh Bharat, I think it was very important for all of us to come together to talk about accessible washrooms, because for women and girls with disability, this is one area which gives them privacy. So if we have accessible washrooms with running water, running clean piped water, and then you have the menstruation health and hygiene material available, and finally you know the techniques to dispose, and to add to it is just, it's a little bit of an assistance for severity of women with disabilities to get assistance from the caregivers. I think it solves the problem. So we need to have an insight and the understanding that this is natural, we have to deal with it, and we have to deal with it happily without shying away, and to look at the health and quality life of girls and women with disabilities. We cannot negotiate with it anymore.
Thank you, Dr. Anjali. At this point of time, I would like to bring deep into the conversation because we are talking about what are the materials available, what are the options available to ensure that women and girls with disabilities can, menstruate safely and with dignity. So, Deep, I would like to know from you that what was your inspiration or what was your motivation behind Sirona and Peabody? And as a company that is working on menstrual health and hygiene management, something that not very few people in India are actually doing, how are you catering to the needs of women and girls with disabilities?
Oh, no. Thank you, ma'am, for the question. I'd say the inspiration, ma'am, is very simple. You just look around, look at your house, speak to your wife, daughters, sisters, and you'll understand what kind of challenges they face when it comes to intimate and menstrual hygiene. And the answer is clear that very little has been done to innovate in this space. So that's precisely the innovation behind the inspiration behind getting into Sirona. Sirona today has solved over 12 plus, India first issues that women were facing, right from lack of sustainable menstrual hygiene products to well, like basic things like there are 100,000 baby diaper rash cream which we are advertising on national television, but women have been getting rashes from pads since decades or since pads came about, but there is not no product around it. There are so many detergents but nothing for period stains. The whole country is talking around pads, but when a woman has to go out for swim, running, jogging, or like you very rightly mentioned, people with disability, the solutions have not been offered. So that's the reason why Sirona came in. What are we doing? I think, ma'am, I do understand that in the best scenario, accessibility has to be there. Washrooms have to be customized, or at least be a little more thoughtfully made for people with disability. Even right now, for pregnant and even for women with arthritis, they are not intelligently made. Leave aside people with disability. So yes, infrastructure is a big problem, and then even product level, the innovations have not happened. So what we are doing is we are talking about menstrual hygiene at all levels. So we might be the only startup of our size and scale to run a foundation. Now foundation goes to the remotest parts of the countries. Like last year we educated about 100,000 women. We donated about 10,000 menstrual cups to these girls, so that they don't have to buy pads again. They don't have to keep thinking about disposing pads, and there is no shame in about if they're using a cloth, etc. For specifically people with disability, we are trying to still find our way, ma'am. We're not an NGO, we're not a government organization, so we don't really have a lot of inroads right now with people with disabilities. But what we've done is, in whatever limited means we can, we talk to them and try to tell them, especially the ones who are wheelchair bound, with physical disability, that they could consider moving on to cups, which is a far better alternate. And also, we are trying to now understand what are the urine related, what is the toilet related issues that they face. So we're coming up now. Initially, Peabody was a device that helps women stand and pee, but then we understand that for a wheelchair bound patient, it might be a different challenge. So we're coming up with extensions in the product so that they can relieve themselves at ease. So those are some of the things that we are doing. But yeah, a lot needs to be done. Miles to go, because even at the basic level, menstrual hygiene is so compromised that people with disability is far more marginalized. Right now for anybody to focus on. I'm thankful to Dr. Anjali and Anjali ma'am for working in this space, and I would love to collaborate and see if we can do anything. For regular people. I mean, I'm sorry to use the word, but I'm saying for all menstruators, we are creating content. We are creating educational videos in multiple languages and circulating them on YouTube. Would love to do a series for people with disability.
Thank you so much for that insight, Deep. I think what you've raised is a very pertinent aspect that, despite being one of the leading manufacturers that is working in the menstrual health and hygiene sphere within the country, there are a lot of blockages, there are a lot of roadblocks that are systemic in nature and which kind of have to be navigated for us in order to reach that goal by 2030, where we can say that nobody is discriminated again or nobody
Absolutely.
falls back behind just on account of the fact that they are menstruating.
Ma'am, I
Uh,
think the only thing we can do, if we can just talk about it, right? If we can just normalize this, like I'm a father of two daughters, and
right.
period is something that I've introduced to my 10-year-old already. And if we can just do it at our home level, especially men, if we can discuss this with our maids also, they might be taken aback. But what are they using? What kind of products are they on? If it starts from there, it'll percolate down to everybody else in the chain. But yeah, unless we
Right.
talk, the taboo and the system will not evolve.
Absolutely. I would now like to go to Anjali, a question to you. That you already also addressed. You spoke about this while in your, when you were answering the first question that I had posed to you. PWDs. When we talk about persons with disabilities, we know that persons with disabilities who menstruate, they are a heterogeneous group. There are different types of disabilities and there are diverse socioeconomic contexts. So, how can we make disability focused interventions and policies which are inclusive in order to address the different needs and requirements? Do you have any, innovations, any best practices, any insights from the community that you would like to share with us, which can probably, provide us the roadmap to have a roadmap to go forward in this direction?
Thank you, Nitika. So yes, agreed that persons with disabilities is is a heterogeneous group, and I mean there are different domains of disabilities, and then they are divided by urban, rural, and even socioeconomic and demographics, socioeconomic demographics as well. So keeping that in mind, WaterAid India, in collaboration with UNFPA, came out with the flagship report on good practices and insights for menstrual health and hygiene management for persons with disabilities. And in that report, what we've attempted to do is to address or to provide solutions for four domains of disabilities across the whole value chain of menstrual health and hygiene. The four domains that we've of disabilities that we've addressed is one, people with visual impairment; second, people with hearing and speech impairment; third, people with intellectual impairment; and people with physical or locomotor disability. And we've addressed, come up with solutions, doable solutions. For all across all the MHHM chain base value chain. And so when we were doing this report, we've spoken with a lot of organizations that working with people with disabilities, and also organizations that work on MHHM. And so some of the things, some of the best practices that I would like to actually highlight is, a lot of focus has been done to create awareness, and make information accessible. So one organization that I would like to call out is the National Federation of Blind in Maharashtra, and they make information accessible about reproductive health rights, and also menstrual cycle to persons with visual impairment, using a 3D model of reproductive system. Similarly, we have the Sanitation and the Hygiene Fund, formerly known as the WSSCC. So in collaboration with Saksham Trust, they developed education videos on menstruation in Indian Sign Language, and they've Indian Sign Language, which basically catered to people with hearing and speech impairment, and they use the same video to have like an audio format for the same video. So it caters to persons with persons with visual impairment. Similarly, when we talk about like individualizing, so I mean it's not it's heterogeneous, right? And also coming with different disabilities, they differ by severity as well, and domains of disability. So we have Aina from Orissa, which actually, they have a very great way of addressing this. So they develop monthly plans, which are further divided by quarterly plans and monthly plans, wherein they develop these targets for persons with disabilities, and they develop these plans to address, to create awareness, create information around their bodies, when to change, how to dispose, based on their level of understanding, on the level of comprehension, the pace of their learning. So that's how Aina has been addressing this. And now coming back to policy and how we can actually have inclusive policies. When we look at menstrual health and hygiene policy, we have good national programs on menstrual health. We have fantastic program on adolescent health as well. But to make it inclusive, what we actually need to do is that make sure that insights from organizations working on menstrual health and hygiene, and insights and learnings and experiences from organizations working with people with disabilities, they are incorporated into these programs, so that MHHM is addressed in some way. But during my conversation and during when I was writing this report, we actually saw that they work in silos. So organizations working on MHHM, organization working with people with disabilities, they work in silos. What they need to actually do is come together and provide these insights to the policy makers, so all of these can be featured and be rolled out. And we've seen this happen with sanitation. And one such example is Orissa and Chhattisgarh. So the people working with organizations working with disabilities and organization working on WASH, they all came together and influenced and advocated for inclusive WASH sanitation facilities in these states. And now the states have inclusive sanitation has become a part of their policies. So similarly, adolescent health programs and menstrual health and hygiene management programs can also be expanded through the inputs by disability people's organization and as well as organizations working on MHHM.
Thank you so much, Anjali, for that insight. And one thing that you said, which rings with me very, very pertinently, is the fact that there are so many NGOs, we are so many CSOs that are working on different issues on the ground, especially on gender-based issues. But the fact that we all keep working in silos and that we keep working in our own little bubbles rather than collaborating and coming together to share those learnings, share our own experiences, and share our networks on the ground to create larger policy decisions is something that we really together need to work upon and go towards. One other thing that really, while you were highlighting some of the best practices that have been there in the report as well, and you talked about how visual aids have been made or videos have been made. I was also thinking that how community-based media tools can be a very, very important intervention in communicating this information to the people that they are targeting. For example, even if we have, when we're talking about videos and we're talking about, visual impairment, but transmitting them, let's say, via community radios, can be a very, very efficient tool, which not only caters to both the visual impairment need of the of girls with disabilities, but also takes care of the lacuna of information that exists as it does now. So thank you for that. I would also, because we are talking about policy, I would also like Dr. Anjali to weigh in here. That Dr. Anjali, as a woman living with a disability and being such a strong champion of human rights that you are, we would love to hear from you on the importance of involving persons with disabilities and ensuring their active participation in decisions that affect them. Uh, how can we do that? And do you have any particular insights when we talk about menstrual health when we're talking in focus to menstrual health today?
Thank you, Nikita, for this important question. I believe that personal is political. So I want everyone to understand this, that shying away from period talks will exclude women with disabilities further. So what is important is you, as you rightly said, the community radio is one way of doing it. We have organizations of persons with disabilities throughout the country, and these are a combination of men and women who are leaders, who have championed advocacy, who have gone out to raise awareness in the communities and families, and also they have gone out to the extent that they are talking to the parents to help their girls and with disabilities to be empowered and educated and start the MHHM uh, talks as well. So I think it is very important that we have a kind of a cascading effect of training, information availability in accessible formats, then talking about MHHM in bigger communities, bigger meetings, and in family gatherings, and also to dismantle the barriers, both attitudinal and physical. It's really important, and I think it will help the adolescent girls to become more healthy, educated, and empowered, so that they don't look back that okay, we have experienced, we have suffered this, but we will stand up for the rights of other women and girls, and we will make sure that they don't suffer and they don't go through the same stigma what they have seen in the past. And I have, this is my personal experience when we have been training the girls and women with disabilities in communities, especially in villages of Rajasthan and Madhya Pradesh, where the stigma is so deep rooted, and there's also this patriarchal the emotional neglect, not spending money on hygiene and menstruation materials, the disposing of these sanitary pads, and equally looking at what should be given to the girls and what should not be given to the what should be given to the boys and not should be given to the girls. It's something which is deep rooted. So what we did was to start from the bottom to make them understand that both girls and boys are equal, and then approaching to these sensitive issues and talking about periods and maintaining one's hygiene, and also how to look after girls with severe and multiple disabilities, because they are made to lie in a corner, not to talk about food, not to talk about going out, not allowing them to be part of the religious gatherings, or even not even speak to the grandparents, because it's taken as a taboo that if you are menstruating you can't even speak to your elders. So this was something that took us a lot of time to remove those attitudinal barriers, and then to bring them at the same level like the other non-disabled girls and women, and make them understand that this is fine, this is natural, accept it, and accept your girls and women with disabilities. Then only they can lead a good life.
Thank you so much, Dr. Anjali, for that. And I completely agree with you that, when it comes to matters that are pertaining to women and women's bodies, they are often communicated as if we are some mysterious beings with absolutely no, the knowledge and the ability to have actually frank conversations about basic physiological processes and needs of women's bodies is quite lacking within our social and individual family life as well.
Yeah, so I just want to add to what Deep has talked about, that women with disabilities are patient and they're wheelchair bound. So please don't take me otherwise. I just want to say women with disabilities are like any other women, and we are not wheelchair bound. We are wheelchair users. There are women with severe disabilities who would be able to take care of their MHHM, or given that they are given that training, that understanding, that awareness, information, and the insight to look after themselves. So it's being very healthy to be menstruating. This is what I wanted to quote. And I also want to quote at the end what Anne said, the UNICEF director for WASH. Investment in menstruation hygiene management will benefit girls today, the women they will become tomorrow, and the next generation. So it's the reaping the benefits of being growing up and developing with others together, and to be there forward as next generation, and there should be no looking back, or and as Digimoto says, leave no one behind. I think there is something that we need to do now, not yesterday, not tomorrow, but today.
Absolutely, I couldn't agree with you more, Dr. Anjali. And I would also like to bring in deep into this conversation because we have been talking about, as you rightly said, that women with disabilities are normal like any other women. And when we talk about women, and there are often this conversation, we tend to highlight them as women's matters. If it is periods, it is a woman's matter. If it is gender based violence, it is a woman's matter. If it is pregnancy, it's a woman's matter. All these issues, the fact that we are very together, like we are very much part of the society that is functioning and that is leading from one step to the other. But this idea of referring these things things as women matters erroneously, these restrict women, these restrict the conversations to just women and girls, and often alienate men from these discussions. So Deep, I want to bring you in, and I know you spoke about this a little bit earlier, but how can men and boys play a crucial role in addressing the stigma and stereotypes around menstruation?
Well, ma'am, like I said earlier, at our level, whether the Sirona Foundation or for-profit part of the division, we are just saying that we need to normalize this by not really making a big deal out of this. It's a very normal, you know, phenomena, and unless we talk about it at all levels, this taboo will not break. So we are having conversations with girls and boys when we are talking to school kids. We are not, distinguishing there that we're talking about menstrual health, so only girls need to know. And similarly, when we are going to corporates, or we are going in villages, we ensure that the husbands and all the male members are also there, because I think both need equal education around this. And unless both the sexes are involved, at least as far as our limited knowledge is concerned, we have really experts working in this space. I don't see this getting solved. And also, Dr. Anjali, honestly, ma'am, we don't consider people with disability any sort of medical or patient. What I meant was that right now, if you're a medical patient, let's say with arthritis or severe arthritis, even washrooms are not made keeping them their convenience in mind. So a lot needs to be done in that area. And yeah, so that's what I think, honestly, that it's going to just get normalized once we start talking about it as we talk about headaches or we talk about other things. It's a normal thing.
Thanks, Deep, for highlighting the importance and the need of holding conversations and just normalizing what is already the normal but is often shushed and under the carpet and brushed under the carpet. I would also like to request all the listeners who have tuned in and who have been very patiently and kindly listening to this conversation. First of all, thank you for your time, for being here, and for listening. If any of you have any questions, you can kindly please request to speak, and Kuljan will help you in bringing you on to the speaker panel and taking your question. So, in case any of you do have any question, do put in the request to speak. And meanwhile, while we wait for any questions from the audience, I will take this opportunity to kind of, because now we are closing in towards the end of our discussion. So, firstly, Anjali, I would like to come to you, and I would like to ask you, what are your closing remarks, or what are the, if you had to, when we talk about menstrual health and hygiene, and when we talk about managing menstrual health and hygiene for persons with disabilities, what are your quick key takeaways that you'd like to once again summarize for us? Anjali, are you here with us? If you are speaking, your mic is actually off. Okay, I think I'll move on to Dr. Anjali. I know you've already given your key points, but any quick closing remarks that you'd like to put forth?
Yes, three important things, and these this is awareness, awareness, and awareness. We cannot move forward unless we make ourselves aware. That is the girls and women with disabilities, and also the people around us, be it male or female. We have to create awareness about it. That this is natural, accept it, and I've already told that I take this as a very important aspect, that personal is political. So whatever is flowing from me is something that needs to be put into the policy, and from policy to implementation. And thank you, Deep, for putting that thing forward, that yes, we need accessibility for sure. There's no one size fit all. We have to adapt, and we have to be flexible according to the requirements of 21 types of disabilities that we have in the Rights of Persons with Disability Act in India. So it's just not that it's challenging, but there is answer and solution to everything. So I think what we need to do is the service provider, the decision makers, the policy makers, and people with disabilities have to come together to find out tangible solutions to make life easier, better, and allow girls and women with disabilities to live quality life. Thank you so much.
Thank you, Dr. Anjali. Anjali, are you here with us?
Hello. Yes. Yes. Sorry.
Yes. Yes, please go ahead. Your closing remarks.
Okay. Sorry. Could you please repeat whatever you said? I'm sorry. I blocked off for a minute and I.
No worries, no worries. So I just said that we have discussed some very pertinent issues here today, and while we are talking about menstrual health and hygiene management for persons with disabilities, and I would also just while we are having this discussion and moving towards the end of it, I would also just like to flag the aspect that when we mean menstruators today, we are not just focusing on the gender binary identities of men and women, because we understand that a lot of people who menstruate do not necessarily like to identify themselves as women or as girls. So keeping that, so whenever the whole crux of this discussion, that while we've held it, we've kept that sensibilities of gender non-conforming individuals in mind. So Anjali, I was asking that as we today discuss the menstrual health and hygiene management for persons with disabilities, for menstruators with disabilities. So, what are your final quick final quick words that you would like to leave us with, which we need to keep in mind in order to move ahead in a more inclusive direction?
Thank you, Nitika. So, every person who experiences menstruation, they have right to right to menstruate with dignity, and respect, irrespective of gender identity, as you mentioned, and irrespective of their socioeconomic status. So three things that I started off with, I'm going to highlight those. So information, education, and communication awareness, something very important, and we should be able to work on that and make it accessible to people in formats. So via caregivers, via frontline workers, anyhow, it is our job to make information accessible to people with disabilities. Secondly, we have to work on appropriate, making appropriate and safe menstrual hygiene absorbents available and accessible to persons with disabilities, and promote it as well. And third, again, third is uh, inclusive infrastructure, and of course, and when I say wash infrastructures, along with disposal facilities at home, at the household level, at the school level, as well as at the community level. And fourth, I think often we also miss out the toll that it takes on the caregivers. So we should be able to bring about caregivers, and also make sure that they are as well included in trainings that we do with persons with disabilities on MHHM, or any other trainings that we do, and their mental health needs, their physical abilities are also taken into account when we are dealing with this. And lastly, I think disabilities organization, as well as menstrual health organizations, need to come together and address this, and advocate for uh, inclusive and comprehensive menstrual health and hygiene management programs in this country. It's 2022. It's high time we started doing that.
Thank you so much, Anjali. You've very succinctly put forth very important points, which are very much the need of the hour. Deep, any closing remarks from your end?
I think all great things have already been said, but I think for all the product companies which are working in this space, I think what we need to do is understand, like ma'am just said, Dr. Anjali said, 21 different forms of disabilities. We need to ensure that we create content to cover all forms, so that none of them get left out. Second would be also to create products keeping right at the design stage. I think we need to factor the requirements and needs of different individuals, and have a wider range, which are the two things that I think we at the company level we need to start pushing more. Other than that, at mass level, as long as we are talking, I think we keep going back to the same thing. As long as we're talking about it, issues will get solved. So yeah, that's all.
Thank you so much, Deep. Isha, I can see your hand raised. Do you have a question?
Yeah, hi Nitika, and panel of members. It was a very insightful and thoughtful for the day as well. Thanks for this wonderful session. Um, Hi, Deep. Actually, I would like to say that I wish if there is an on-off switch for our human body, who wants to menstruate, they can, and who doesn't want, they need not. So, because we see people with different abilities and disabilities in the country and in the world, and it's very hard for them to sustain and carry forward with their lifestyle. My point here is like, instead of tampons or menstrual cups, because these are little difficult to use for a person with disability, why don't we introduce a diaper like undergarments, which is very easy to use, and especially for people with disabilities. What are your thoughts on that? Or are there I've seen some products already in the market, but are there environment friendly, as well as are there cheap in terms of money wise and things like that? Can you share
Uh,
some thoughts on that?
Yeah, no. Thank you, ma'am, for that question. I think so far we were just pushing on cups, but I've just written to Dr. Anjali. Perhaps I'll take an audience with her to figure out what products can we really work on. And should there be is there a need for it? Absolutely. Do we have the right solutions right now, which are affordable and environmentally conscious? I personally have not seen much of them, at least not in India. Is there a need? Absolutely. Is it something that we would like to work on? 100%. So we do have reusable pads and period underwears and period panties, but have we made them keeping people with disability in mind and their requirements in mind? The flow, the pain, and all of that. No. So we need to customize that. But yeah, point well taken, and we'd certainly come back and maybe by the time we have this next call, we'll be able to show you a range for people with disabilities.
Yeah, the reason why it struck me is because using tampons or menstrual cups is really hard for a normal person itself, I believe. So people with disability will have even more challenges to use it, and hence I came up with this suggestion. Probably give it a thought. Yeah,
Well taken. No,
yeah. Thank
absolutely.
you
It's
so
just that, in
much.
fact, cups for us, was introduced as a concept for people with disability by a girl, LSR girl, and she's the one who said that I moved to cups because it's just more. I can't change the pads, and my caregiver is not with me. But I hear what you're saying, and point very well taken. But it might not be a normal thing for all. So yeah,
Thank you.
relevant.
Yeah, thank you.
Can I
Thank you so
just,
much.
yeah,
Mm,
yeah.
Please, yes, Dr. Anjali.
Nitika, yeah. Isha, this is a wonderful question that you asked, and we were actually talking about adaptation. And I remember one of the researchers that we were doing with school-going girls, and there was a girl with severe disability with cerebral palsy, and in the 10th standard, and she managed to come to the 10th standard because the first thing that she quoted was that I use a diaper. It was a regular diaper that she was using during the menstruation days, and her mother was quite proud of it that because of that she was able to make it. And that made us realize that at times we are very shy to even talk about such things. And her mother and she kept boasting about it, because I use it, that is why I'm in the 10th standard and I'm going to complete my board. I was so happy and glad that something as simple as a diaper can be used. So I'm sure people in the industry, especially people like Deep, can come up with such innovative products. But we just need to see the individualized needs, the requirements. Because for a woman with disability myself, I will not be very happy, or might not be very convenient to use a tampon or a cup. So it's all individualized. Everybody has a different need, and everybody has a different disability. And even two women using wheelchair or two women using calipers, they also have different needs. So we cannot put and categorize one kind of a design for everyone. So I think it's a the mapping of the market, the demand driven market, and the requirement from the girls and women with disabilities will help us to find solution to such questions.
Okay. Thank you.
And
Thank you,
for ma'am,
doctor.
I'll take your help. Huh? I'll reach out to you.
Absolutely, Deep, anytime, most welcome. Yeah, thank you.
Nitika, if I can also add to what Anjali, Dr. Anjali.
Absolutely.
When we were inviting key informants for our flagship report, so in that we also found organizations that have been working with low cost solutions, or like coming up with innovative methods, or caregivers coming up with innovative methods. So there was one caregiver from Orissa that actually shared, the daughter was a person with intellectual disability, but also she was uncomfortable with how sanitary pads felt, and she was uncomfortable with the sensation of it. And they would also, and there so when persons with disabilities are also, they take out their sanitary pads in public, um, as well. So now what the mother actually did, what the caregiver actually did, was sew pads, like cloths. She took like multiple cloths and she sewed those cloths to the underwear. And that's how the person with intellectual impairment has been wearing that, and it has been working out very well for them. And the cloth does not even, so it's sewed so the girl is not being able to take out take the cloth out, and at the same time, it the sensation that the sensitivity to the sanitary pad sensation that she felt, it's not there anymore. And we also heard of lot of organizations working with people with disabilities, using incontinence materials like adult diapers as well, to for persons with disabilities during menstruation.
Thank you for sharing that, Anjali. As you know, it is rightly said that the need is the mother of invention, and until and unless we do recognize the needs of people with disabilities, and we start looking at it from an individual perspective and not at the homogeneous group, we will not be able to come up with the solutions, come up with the innovations that are required for us to move to a space where everyone can menstruate with dignity. We are still living in a world, in a space wherein women and girls are isolated from their own homes. They're isolated from their own families at the time of menstruation, and they are put in a different physical space. They are put, as I said, menstrual suppression is a very real phenomena where people go to the extent of sterilizing women at a very very young age, just because they don't want to deal with the fact that they have a menstruating person within their ambits. And so at this point of time, when we are still ravaging with these patriarchal social complexities of the system, it is important for us to kind of understand and relook at individual needs, especially of those with people with disability, and come up with the required solutions to move to a more inclusive situation. And today, I think we've had a very, very fruitful discussion, which has led us closer, probably, towards realizing the need of the hour and realizing what are the steps that need to be taken, whether it is awareness, whether it is creating content and creating resources that talk about menstruation and menstrual hygiene management, specifically from the point of persons with disabilities. It is important for us to do that. It is important for us to think of ways of dissemination which are friendly, which are friendly to the needs of people with disabilities. We need to think of inclusive, as Anjali has rightly said, that we need inclusive wash infrastructure at community and at a home level. And we even need conversations, as Deep said, at a home level, to encourage and to normalize the fact that menstruation is not a big deal. It is one of the most basic natural physiological aspect of a body. I'm also going to reiterate the fact what Anjali said, that it is important for us to involve caregivers into this conversation, their sensitization, their mental health situation, and for us to create an environment where all of us, whether it is CSOs, whether it is individuals, whether it is manufacturers who are working within the menstrual health sphere, we can come together and work cohesively towards this one particular goal, rather than working individually in our own silos and not creating the impact that we can together. So a big thank you also to UNFPA for organizing this, for giving us this opportunity to have this conversation and marking this very important day with this very, very pertinent discussion today. As we close this discussion, all I'd like to say is that, most of us are often partial to the color red. We consider red auspicious in our customs. A red rose is considered the ultimate expression of love. The red of the setting sun is a sight that often warms all our hearts. So, how come that red itself becomes dirty when associated with one of the most natural processes of life? As we move into a better sphere, as we move into the discussion of Menstrual Hygiene Day, let us shed our discriminations and accept the red for all it stands for. With this, I bid you all a very, very good night and thank you so much for joining us today.
Thank you, Nitika ma'am, for being such a brilliant host.
Thank you,
Thank
Dee.
you. Thank you, Nitika. Really enjoyed and love to connect with everyone again. Thank you.
Thank you.